Patrick for Life has educated 10,000 students in the 4 district school boards over the past 5 years about HIV and AIDS, and is equipping you with the knowledge and skills necessary to make healthy lifestyle choices in your present and future life through daily physical activity, through character and self-esteem development. This will promote a social, health, and economic benefit to our society today and in the future. And this was Patrick's wish. HIV is not like other diseases. We know how to prevent it. But this year, 1,000 people will be diagnosed with HIV in Ontario, and there is no cure. The 10-week Participatrick program is an instrument shaping a child to grow and mature within a framework of values that will promote healthy living. Patrick is the human face of HIV. Patrick's story is a tragedy wrapped in an emotion that compels us to take action and transform our world. Meaningful action requires meaningful engagement. Today, and the preparation in your school is meaningful engagement. Each one of us has a role to play. Through teamwork, so much can be accomplished and achieved. What you have achieved here at Ferris Glen is extraordinary.
Well, the most heartwarming moment was when I delivered a package last week at the school, and the kids didn't want to do their schoolwork. They already wanted to draw for the teacher what the HIV/AIDS virus looked like. And so I'm so pleased that the children are welcoming this in a very age-appropriate way, and the teachers as well, and the school direction, and the school boards.
6 years and counting, give me an idea as to how you feel from where you started out 6 years ago to this point, with Participatrick.
I distinctly remember the level of worry when we walked into the schools the first year, but it had been approved by the board directors that the family was going to do presentations about HIV and AIDS. And within 3 years, then the school was saying, well, we know that only a certain number of students can participate, but could the whole school come to your talk? So little by little, it's become very much more comfortable.
It's amazing because I can think back, it's a 25-year battle with HIV and AIDS, and looking at the knowledge that these students have and how far you've come must give you a sense of accomplishment.
Yes, it makes the work worthwhile, and we continue to bring the message of incremental and developmental education, building self-esteem in a generation of youth that are going to know about a disease that's preventable.
And that is the outcome. I mean, the biggest outcome is that these kids are going to be healthy, active, and know their choices and use that prevention.
Yeah, so someday if they have a big decision to make with the 20 minutes of daily physical activity for 10 weeks, if you start the program thinking you can't do it, you definitely end the program wanting to do more. And so if you feel good about yourself, then if you have a big decision to make, you probably will make the right one for yourself and for the person that's with you.
What does the community need to know about Participatrick and what the future holds for the program?
Well, we're very happy that we have qualitative and quantitative research. We interviewed 1,000 students